Now we know that the patient is going to be a hypermetrope, which is the first risk factor. Because when you have a small eyeball, that is a hypermetrope or a long-sightedness, they're going to have a plus power. Now this is going to be the small eyeball for this patient. When a patient is going to have a smaller eyeball, which means that the axial length is reduced. When their axial length is reduced, which means that the anterior chamber is crowded, is going to be small, which is going to increase the risk of this angle getting closed easily because of some triggers. So first risk factor is to have a small eyeball. Just to recollect, if you can know that when you have a small eyeball, what happens here, there is going to be a past pointing of the light rays. The light rays are going to fall beyond the retina. So I want to give a plus power such as a convex lens to converge these light rays and to make it fall on the retina. That's why these patients will have a plus power or plus prescription. That is a clue in the question. So the small eyeballs, especially patients who belong to the Oriental population, a Chinese person for example, will be at more risk of angle closure. The second risk factor is why the angles should close in these patients. There can be a lot of triggers. There are two triggers. Basically, the trigger should cause a dilatation. The trigger should cause an increase in the pupil size, therefore causing an angle closure. That can be a dilating drop, such as a tropicamide solution, which is normally given to dilate a patient's pupil to look into the back of the eye or the retina, or it can be a dark light. When you go to the dark, the pupils dilate. That's why in our patient you can see that turning the lights off exacerbates the patient's pain.